Sickness benefit claimants will get training in a push for a return to work. I'm going to read into this more from the Times, you guys. So it says about half of those on the highest level of incapacity benefits cite mental health problems. So there are a lot of factors I need to put in here. So let's lay down some of the cards about some of the things about entitlements rather than calling it benefits. Yeah, the system is designed to protect people who cannot work or go through a rough time. It's there to pick people up when they need it. It's not something that people should scourge on and should spend all their lives on. Now, are there people out there that are doing this? Yes, I don't think there's any deniable that. As somebody who most people will claim to me being on the centre left or lefty, if you want to put that, I absolutely agree. There are people who are claiming benefits and are not really doing anything with their lives. They're just kind of sitting there on the entitlements, not working and whatnot. There are those people out there, and that is a problem. However, there are a lot of people out there who cannot, for whatever reason, they cannot work. It can be all sorts of reasons. Now, we also have to remember, and this is really, really important, this is something that you don't hear from Reform UK people. And I really want to talk to those who are Reform UK watchers here, is that they don't talk about the humanity in all of this. Yeah, you hear Nigel Farage talking about cutting the welfare state all the goddamn time, wanting to cut the welfare state, cut the welfare state, cut the welfare state, but never talking about the humanity of why. Why are these people in this situation? Now, you can't tell me that every single one of these people are here because they want to scourge off the government's welfare system. That's just not the case. And there are no facts or statistical analysis that proves that otherwise. Yeah, there are lots of people who are in this because of, as it says, mental health issues. There are some who have disabilities disabilities that are so severe that makes them unable to work, literally unable to work, like unable to literally go to the toilet, for example, or can't even get out of their bed. There are people in those situations where they need to be able to be covered by the government. Okay, that's just a reality. Yeah, and the state should provide for them because they cannot provide for themselves, and that is what we are supposed to do: help these people who cannot help themselves. Because again, from the humanity point of view, Nigel Farage wants to make every single one of these people work. So how do you do that? You know, how can you possibly do that? How do you make someone that can't even go to the toilet or can't even get out of bed? How do you make that person an employer and get him into employment? Exactly. I suppose someone might say, well, you just give them a computer and teach them how to use a laptop. They can make money somewhere on there, like web design or phone call or whatever. It's like, is it really that simple? No, I don't think so. And also one of the things in here that they plan on doing, which I believe they were already doing here, and we'll get to it as well, is that they are going to be calling up people more often. And I don't, this is under Labour, by the way. And while, of course, I understand that the needs of making sure that people who are claiming benefits, you know, that they are doing something with their lives, and that so that doing something with their lives. We're talking about people who have mental health issues, and rather than trying to chase them, trying to look at any and every kind of reason to take benefits away from them, take universal credit away from them, we should be looking at ways that we can help these people. And unfortunately, the biggest barrier that we have, especially in the welfare state in England, I'm talking about England specifically here. I can't speak on Scotland, Wales, and Northern Ireland. One of the biggest barriers that infuriates me more than anything about this is when we have people who cite mental health issues or cite benefits that of certain disabilities. What they do not have in these conversations between the job centres and the DWP and these people is you do not have a doctor, a health professional, an expert on this in these conversations. This is the biggest problem about our welfare system in England, is that you must have a healthcare expert involved in these conversations. If you don't have that, who are you, some guy sitting in the DWP or in the job centre, who are you to say whether somebody can or cannot work? You just don't know, no matter what, whether it's video calls or whatnot. You're not a doctor. You don't have health expertise in any way, shape, or form. That's why you need a medical expert to be able to analyse somebody who claiming that they have, whether it's mental health issues, whether they've got other health issues, or why they need these benefits and these entitlements. And the doctor says, based on their analysis and whatnot, and says, yeah, this person has X, Y, and Z, then you can't argue that person's case. Now, I've said this many, many times. I am all for helping more people back into work. I'm all for it. Everyone wants to help encourage people back into work. Yes, of course, it's a good thing. And actually, there are in some ways, getting back into work actually can help your mental health. There are some scenarios it's different. Remember, everyone is different. You have to remember that. There are some cases where getting people back into work actually improves their mental health. But not everyone can have that. So I think that context really, really does matter. But this Labour government doesn't really look at the humanity in all of this. And we know that because based on what they tried to do, they tried to cut disability benefits without even consulting disability campaigners in any way, shape or form. And that should scream red warning signs, if it's not already to you, thinking they're not even talking to the very people that they're cutting the benefits from. Yeah, they did not talk to them. Like the very people that they're cutting the benefits from, they didn't even consult the groups in them. That tells you everything you need to know about certain people inside the Labour government. And completely understandable why people wouldn't want to vote for them either. I mean, I personally think the Greens are beneficial, but more people hear about reform than they do about the Greens. That's the sad reality of it. But that's another topic for another day. But let's read a bit more into this, guys, from the Times. So, it says sickness benefit claimants will be routinely contacted by the Job Centre staff for the first time under plans to bring down the welfare bill by targeting 2 million people who have no requirement to seek work or prepared to do so. Now, I don't agree with this statement that it's the first time. I don't agree with that at all. I think people were already being contacted by the Job Centre. So I don't know where the Times is getting... I don't know why, who I believe it's Andrew Fox who wrote this piece, is claiming it's the first time. This is not true at all. The job centres are routinely contacting people. Routinely. So to claim that they're not is false. Okay? I've heard countless stories. Not just people in my comments, but people that I've met and who have gone through the benefit system and told me they are routinely harassed by the job centre. So the claim that that this is the first time is nonsense. So this is obviously someone who's not done their homework. Tens of thousands of people with mental health problems, bad backs and other conditions who claim benefits without any conditions will be offered skill training and preparation for employment ministers have told job centres to refocus efforts on a shocking rise in long-term sick. Yeah, this is obviously, like I said, you have to treat every single situation different. And we have to remember that these are all human beings as well. And it shouldn't be a case of you kick them out of the house and force them into work. No, there needs to be a humanitarian side of it. And unfortunately, that's missing when it comes to all this work. Sickness has replaced unemployment as a dominant driver of universal credit claims. Almost half of people who are claiming Britain's main working age benefit have no requirement to work or make preparations such as drawing up a CV. Drawing up a CV is, for some people, is very difficult to do. I personally have trouble drawing up a CV. But there are websites that can do them for you. Some of them can do it for free, and there's others that obviously are paid to as well. So if you don't know where to start with a CV, it's a simple case of Google. You have it right in front of you. That's my message for people who want to do, who don't know how to do a CV. There are 2.2 million people deemed to have limited capabilities for work or work-related activities, such as job preparation. More than 3/4 of those applying for incapacity are put in this top category have no condition attached to their benefits. Ministers will set out plans to shift the approach of government work coaches who focus on advertising and monitoring job seekers towards the long-term sick. Pat McFadden, the Work and Pension Secretary, said 2 million people stuck on benefits with no opportunities and no help and no prospects is the shocking inheritance that we must tackle. I'm determined to give people the skills they need to thrive in the modern economy and to help them move into good, secure jobs. I mean, it's just waffle from Pat McFadden. He's not going to, like, the only I see more people becoming homeless as a result of this. And remember, this Labour government promised to end homelessness as well in its first Parliament term. People forget that as well. They're not going to hit that target at all. Not with what they're planning to do anyway. 1,000 specialist employment advisors based in job centres around the country will make their first national push to contact those on the top of incapacity benefits, and they will offer advice on skills or job application, as well as specialist training or medical help geared towards employment. These dedicated staff are key to unlocking work of tens of thousands of people who can get on with our plan to get Britain working, ensure our welfare system is fit for the future, and deliver economic growth, McFadden said. Like I said, if this helps people, great. But what I don't want to be doing is forcing people against their will. While we offer, and it will initially be voluntary, ministers are considering that imposing a responsibility to engage on the long-term sick that will require them to start talking to employment support services. About half of those on the highest level of incapacity benefits cite mental health issues. Nurses argue that working can often improve their conditions. Back and joint problems are the most common reasons to claim. Yeah, as I've said, I've mentioned the health, that it does help mental health, can help in some ways, but sometimes it can also have the opposite effect in some cases. There is nervousness in government about the further contentious welfare changes after Keir Starmer was forced to abandon £5 billion of cuts to separate disability benefits in the face of a revolt by Labour MPs. Yeah, because they wasn't thinking about disability people at all. They were just thinking about cutting £5 billion and not thinking about the consequences of it. Tells you everything. It says a lot about this government. McFadden is attempting to focus on improving support for the long-term sick after evidence showed that it increased the chances of getting a job. He's hoping to offer to help 65,000 extra claimants this year. However, experts caution that even $1 billion a year boost for employment support is likely to reach only a fraction in the long-term sickness and have support limited impact in the short term on the spiralling cost of sickness. Britain spends about $8 billion a year on all sickness benefits, a figure that has increased more by than $20 billion since the pandemic, and is on course to hit $100 billion by the end of the decade. Some in government want to press ahead with more reforms in the benefit system after universal credit health premiums were halved for new claimants, in one of the few elements of Starmer's reforms to survive. McFadden has ruled out changes to disability benefits until a review concludes next year. There's not made a similar guarantee on universal credit as ministers seek to tackle preserve initiatives to be signed off sick. So Stephen Evans, a chief executive of Learning and Working Institute think tank, said it was sensible to do more on the long-term sick, describing the initiative as refocusing a significant proportion of the government's work coaches towards people who get little help today, likely achieved by recruiting the amount of box-ticking checks on unemployment claimants. He added, there is evidence that this kind of support can make a positive difference, but to be a game changer, the government must come up with much broader plans to engage people on long-term sickness benefits and refer them to a wide range of help. Yeah, this I absolutely agree with, but I also think this is where you need to work with organisations, with campaign groups, with communities, to helping people as well. It's not just a case of individuals. Like, what can, there needs to be more cooperation. What can communities in that area do to help somebody as well? Can there be something there that can help people as well? I don't think, and like I said, there needs to be a health expert when it comes to helping these people as well, because not everybody's case is different, and behind every single one of these people who are on benefits, there is a human being with morals, with feelings here, and they must be remembered that they are human beings, and that everyone's situation is different, and we shouldn't just assume that they are all scroungers sitting on benefits, having no life whatsoever, because that's not the case. There are some people who are in circumstances beyond their control as well, beyond their control, and that's a really important factor to take in when talking about this. As I've said, I want to help people. I'm more than happy that I'm all for pushing people, helping people get back into work, but I'm not for forcing people against their will in doing so as well. But what do you guys think? What do you guys make of the talk around sickness benefit claimants and to get them training, pushing them into work? Do you trust this government to do so? Because I certainly do not. They say a lot of things on paper, but again, I'm very skeptical. But let me know your thoughts and more on this down in the comment section below. If you found this video interesting and informative, please hit that like button, share this across social media, subscribe if you haven't already. Check out Rumble and Patreon for exclusive content. And if you want to financially support me in the work that I do here, you can do so by becoming a YouTube member for as little as 99p. So thank you all so much for watching, and I hope to catch you all very, very soon.